Hi, good morning, Anvesh.
Hi, morning Priyamvada.
Very warm welcome. Thanks for joining us today in Conversations Cafe in CSI 2024. We know that Ayushman Digital Bharat Mission is meant to uh, create a national digital health ecosystem in India. Could you please share a little about what are the benefits of digital health in India?
Uh, your question has some of the answers, actually, I would say. So, when we talk about accessibility, affordability, and in a safe manner, right? So, we are trying to move away from physical regime of actually carrying the documents and going around with umpteen number of papers and all of it to actually having all the electronic health records kept on our own not our own registry or database, but in the respective databases, but which can be accessed through consent of the patient or the citizen. So, which reduces a lot of uh, burden that is there around remembering and knowing what happened earlier. Especially in the healthcare, we have uh, cases where we'll have to showcase to the doctor that what has been our medical history in order to get a better advice, right? So digital health in a way actually enables that. Digital health, in simpler words, is to have electronic medical histories of people in a very accessible manner. So ABDM actually envisages that. So uh, again, it creates patient centricity. People will be able to kind of avail the services at their fingertips and check the discover the uh, services that are available around their places. So all such things are possible only when we have an integrated digital health ecosystem. And ABDM does that now. ABDM envisages that, and we are in the process of actually kind of creating that now.
Okay. I think in a country like India, this is a very humongous task.
Right.
Could you please share what are the biggest challenges when you are trying to support the work that is happening in ABDM?
Um, I can classify the challenges into macro and micro kind of challenges that we have. Macro, as you said, we are not a simpler country. We are, as much as we boast of our diversity, that in itself sometimes becomes a challenge for us. How do we uh, kind of create such a robust system for the entire country with such a diversity, right? People with different digital literacy levels, people with different kind of uh, access to internet and technology, and then we have, so we can't actually simply roll out anything on a blanket manner, right, in a blanket manner. So it is very difficult at a macro level to even envision what we want to do for the entire country. And we will face a lot of challenges once we go to the local level and the state level, district and block level, and each which has to be handled at
Yeah.
each level. So that in a kind of macro vision level challenge that we have. At a micro level, when we are trying to introduce something like a HIMS, a Hospital Information Management System, in a clinic, you come across doctors who are not so willing to move away from physical prescription to digital prescription. So change management, behavioral aspect comes into picture. How do you handle that part, right? So while at the vision level, at a macro level, the country and the policymakers need to think about how an architecture can be there that can enable this thing in a very efficient manner, while keeping in view of the challenges that they can encounter on the ground. And people like us, development partners, interfacing agencies, and all of them will have to deal with the micro level challenges as well, where we have more to influence citizens on how they can adopt personal health record applications, PHR applications, so that they start using their digital records from their PHR apps and all of it. And then working with facilities, professionals, health staff in behavioral change and change management processes. So I would say that and also I would, the other part is the technological part of it, where we do not have too many players offering services and products at affordable prices as of now, which becomes an entry barrier for a lot of the facilities to come and get into this ecosystem. So for us to kind of create this ecosystem, we need to have as many startups or probably organizations, institutions creating products and services that are accessible by a country like us and as large as it is right now.
So, I know that Piramal Foundation, the Digital Bharat Collaborative, has this focus and priority of improving and supporting the digitization of healthcare in India. Could you share a little more about what you are doing and where are we right now? Because I think you mentioned that it has been almost 3-4 years since you have started working on this. So what are we doing and how does the scenario look like according to you?
Yeah. So it all started when Niti Aayog published this paper in 2018 with National Health Stack being envisioned, and where they spoke about registries, and creating a service interface. Unified health interface is another thing which enables the services. And there is another part to it again. There is National Health Claims Exchange that is envisioned. These three are very critical components within ABDM framework and architecture. So when it comes to where we are right now, we are in the early stages. So as I said, we have probably reached 1/5 of the healthcare facilities in the country as of now. Because if you see the number of health facilities in the country, it could be around 20 lakhs, something like that. And when you look at the registered health facilities on the ABDM ecosystem right now, that would be around 4 lakhs, something like that. Similar is the case with health professionals as well. And when it comes to saturating electronic health records, like probably in the country, 600 crore health records are generated on an annual basis, and probably we are digitizing 2 crores or 3 crores of them now. So this is where we are right now. There is a long way to go, and public sector could be onboarded to ABDM ecosystem easily, and but that is probably because of the efforts from central and state governments. They sensitizing health staff, creating state mission offices and all of it. So we work with state mission offices in furthering this efforts. So how do we actually talk to the CMOs and health staff to bring public health facilities onto this ecosystem? The bigger part is private healthcare, right? Bigger part is private healthcare, and unless they find it very incentivizing for them, and also they derive some value from it, which is not very instant gratification, because it will take some time for them to understand how their services are improving with the help of this digital health records. So that will take time, but efforts are on right now. So we are working in Bihar with state office, UP for the microsites, which is for private healthcare onboarding onto ABDM. And also we have initiated efforts in Assam and Chhattisgarh as well.
You mentioned Bihar, and we know that there is some excellent work happening in Bihar. Could you share some examples of certain success stories that you have witnessed, and that will be good to also, they may be taken and scaled in other locations as well.
Right.
So would you like to share some examples?
Yeah, so in Bihar, one of the biggest success stories has been the onboarding of all the health facilities, public health facilities, and also the professionals onto ABDM ecosystem. So there were about more than 12,500 public health facilities and about 27, 28,000 health professionals stationed in these facilities. So all of them had to be onboarded onto ABDM, and when we worked with the state and also the PMU at that point of time there, not even PMU, but the organizations who were supporting state at that point of time, we played a critical role in onboarding all those facilities in a campaign mode within a span of two months.
2 months.
2 months, 2 to 3 months actually, and also it is not just the registration that matters. ABDM's vision is to create verified registries. It is so that you are not actually going to find a quack on the platform which is government promoted. So in that case, you will find all the verified professionals and facilities there. So verification in itself is a process, and for example, for the facilities, it has to be done at CMO level in the districts. But for professionals, it has to be done by the medical councils, respective medical councils, where the doctors or nurses have passed out from. So we will have to sensitize them. We'll have to work with them that yes, so all of them are actually coming from your own respective institutions. Please verify those records so that they are shown as verified professionals on the platform. So those could be done by us in Bihar. That actually I think is one of the biggest effort from our end. And now we are also moving into private sector adoption. Yeah.
Okay. You mentioned about it's very different when it comes to private sector. Would you like to throw some light on what is the difference, and how have you navigated through those challenges?
We are still navigating, I would say. we haven't we haven't found a crack at completely because when we are working with private sector immediately asks like, is it mandatory? But ABDM by design is voluntary for citizens and also for the health professionals and also facilities as well. So when it is voluntary, no one would actually try to kind of jump into an unknown territory, which is little uncertain for them. And they would, I mean, as human beings are, we are averse to risk and change, right? So people do not accept the change. So when we go and try to bring them onto this ABDM ecosystem, they would say like, what is in it for me, and how can I be benefited? But we are showing them a futuristic picture. We are not showing them an immediate future, right? Like you don't have immediate quick win in ABDM, except for DHIS, a Digital Health Incentive Scheme, which provides financial incentives for creating electronic health record in a facility. So that is one of the things which is a quick win for them. Otherwise, working with professionals, private facilities and doctors, convincing them to see the benefit out of this immediately, and so that actually is a behavioral change which requires a lot more sustained effort. Yeah.
Right. So, which are the other stakeholders who you are working with, and what has been their role in instrumentalizing this?
I would say this is not a complex framework, but it is a multi-stakeholder ecosystem. So NHA holds ABDM as the driving body. Actually, NHA drives it completely. So though it is a central driven scheme, states have to implement it. So there is a catch there, like how the message from central passed on to states, and how states perceive that as a priority and actually start implementing it in states. So NHA, state mission offices are critical stakeholders from that lens. So policymakers lens say they are the ones. People like us, NGOs, interfacing agencies like who have implemented ABDM related activities of private sector adoption and all of them, they are also stakeholders. Citizens obviously are at the center of it, because citizens have to kind of create their electronic health records and actually start accessing them. And there are consulting firms, providing advisory support and creating use cases and all of it. Health professionals, health staff in public facilities, private facilities, and HMIS players, the hospital management information system, and labs के लिए, like the people who are developing the solutions and products. A lot of technological interventions are required for ABDM to kind of be effective and efficient. So they play a critical role. So all of us have to come together. So I would say it's a combined effort of so many stakeholders for this to succeed. Yeah.
So you said that earlier that we are still in an initial stage. We are still at the early stages. What are the next steps? How do you see this moving? In the near future. What are the plans?
Uh, Again, I will go back to the national level progress that we have made. So if you look at creating the registries themselves, around 65 crore Aadhaar IDs have been created for about 140 crore population that we are, right? So a long way to go. And 1/5 of HFR, HPR, like health facility registration and health professional registration. And so these have to be saturated to go with. And while these are being done, the other two parts which I spoke about, the unified health interface, which enables the services among transactions among these databases, right? Like as a citizen, I should be able to find facilities around me or professionals around me who can offer me services. Be it a teleconsultation, be it be an ambulance service, be it be a diagnostic service that I require, lab report that I require. It is like an ONDC for UHI is more like an ONDC for healthcare. So you bring in multiple players, multiple APIs. It's an open digital ecosystem. So how that enables these services in UHI is another part. So creating use cases is going to be very critical. That is where the value is unlocked. So that is major thing. And then is the National Health Claims Exchange. So insurance, for it to be made transparent, cost effective, and also quick, right? So this is again envisioned within ABDM. So enabling these two and kind of furthering these two will unlock the ABDM's value in future. So we look forward to that. We look forward to be part of these use cases that are emerging and how do we do this. We are hopeful it may take 5 years, 10 years, we don't know because a lot of moving parts. So we look forward to it.
Well, all the best for that, and thank you so much for sharing your experiences and learnings with us.
Yeah.